Today's episode is brought to you by the FAM Certification Program. FAM is the training program you've been waiting for. Designed exclusively for women's health professionals, FAM gives you the tools to not only teach fertility awareness to your clients, but to use the menstrual cycle as a diagnostic tool in your practice. FAM is the only program that will equip you to start teaching your clients within a manageable 9-month timeframe. We cut out all of the fluff and focus entirely on the skills you need to master to support your clients. There's no program like it anywhere. We'll be starting in early 2024. Head over to fertilityfriday.com/FAMLive to join the waiting list and be the first to know when registration opens up again. That's fertilityfriday.com/FAMMLIVE. This is the Fertility Friday podcast, episode number 497. If you have wondered why doctors aren't as knowledgeable in fertility awareness-based methods as we would like them to be, or if you've wondered why they may not be able to look at your charts and base your treatment on what they see or what changes, or be able to really interpret those charts, you will really appreciate today's episode with Dr. Marguerite Duane. We really get into this concept of restorative medicine and where fertility awareness cycle charting can fit into the equation. We also get into why most classically trained physicians are not able to utilize the skill set, why it's not something that is taught at medical school. And we also talk about how to find medical professionals who may be more knowledgeable in this skill set. And for the record, when you are going to your regular doctor, unless they have taken time outside of their typical medical training to learn these things. So with that in mind, it is much more likely that your doctor will not be familiar with these techniques. Before we jump in, let me tell you a little bit about Dr. Marguerite Duane. Dr. Marguerite Duane, a board-certified family physician, is co-founder and executive director of Facts About Fertility, a nonprofit organization dedicated to educating medical professionals and students about the scientific evidence supporting fertility awareness-based methods and restorative reproductive medicine. She also serves as an adjunct associate professor at Georgetown and the University of Utah. Dr. Duane also cares for patients via a direct primary care house calls-based practice, MD for Life. Dr. Duane trained as a Cretan, Femme, and Neo-fertility medical consultant and a Teen Star educator, giving her an in-depth understanding of multiple fertility awareness-based methods. So without further ado, let's go ahead and jump into today's episode. And I'm really excited to be here once again with Dr. Marguerite Duane. It's always a treat to have her on the show. Welcome to the show.
Thanks, Lisa. I'm delighted to be here again.
Yes, it's been a minute since we chatted. We had a lovely pre-chat and we were able to catch up. And I'm really excited to get into our topic of the day. And so the topic that you shared with me to talk about today is restorative reproductive medicine, which I'm really interested to get into. So for anybody who's listening and may not be familiar with your work, who may not have heard one of our previous episodes, of course, I'll link our previous episodes for anyone who wants to learn a little bit more. But maybe just share with us kind of the high-level overview. I think for those listeners who know you, they would know you as the founder of FACTS, the Fertility Awareness Collaborative to teach the science. But maybe share with us I'm sure that your intro could be like an hour and a half, right? But share with us the kind of high-level summary of what prompted you to start FACTS, what it is, and what you do.
Yeah. So first and foremost, I'm a family physician, board certified, care for patients from cradle to grave, or as I like to say, from lust to dust, since I really focus on, before birth. Yeah, I trained in Lancaster General Hospital in Lancaster, Pennsylvania. And that's actually where I first heard about fertility awareness and female cycle charting when I was a first year in my residency training, having never learned about it in medical school. And when I discovered these methods and how they really can help address women's health and be used to help couples with family planning, I was blown away and I wanted to learn more. And I was also angry that I'd never heard about this, angry that when I had my own cycle-related issues in college and was offered birth control as the solution, which caused more side effects than helped address issues, I was frustrated. And so a decade after first learning about these methods myself, when I was on faculty at Georgetown, where I've served as an adjunct associate professor since 2004, I had an opportunity to teach a small group of medical students about these methods. And the response was so overwhelmingly positive. The students were like, why isn't this something we all learn? I thought, you're right, this is something we should all learn. And so that's what led me to start FACTS. At the time, it was the Fertility Appreciation Collaborative to Teach the Science. Now we officially became our own nonprofit this past year and are officially FACTS about fertility. And our mission is to educate current and future medical professionals about the science of female cycle charting using fertility awareness-based methods, the evidence behind these methods, both from a family planning perspective to help couples achieve pregnancy or prevent pregnancy, as well as how the female cycle can serve as the fifth vital sign, which is why I love the title of your book. It's also the title of one of our webinars that we offer for the medical professional community. And it really lays the foundation for the restorative reproductive medical approach.
Mm-hmm. I love it. I love that you're in the world. I love that we had a chance to meet in person. I hope we have that chance to meet again in the near future. And I also really enjoy it when I have clients or practitioners who are saying, why don't the doctors know this? And what can be done? How do we teach the doctors? And I'm like, wow,
It was
I know
funny
the
because
perfect person who's already teaching the doctors.
I don't know if I shared with you. I mean, back started when I taught this elective in 2010, 2018, it was officially approved. We would have a couple students every month. But then, of course, with the pandemic, Georgetown sent an email saying they're shutting down all their electives. And I responded, but my elective is entirely online. And so our elective exploded. And in the last 5 years, we've trained nearly 1,000 medical students, not only from all over the United States, but Canada and all over the world. And in March of this year, March 2023, I had the opportunity to present about our FACTS elective at the International Institute for Restorative and Reproductive Medicine conference in Lisbon, Portugal. And I had doctors from Croatia and Hungary and Chile and the Ukraine and Mexico say, how can we bring this course to our medical students? And I was shocked to think, wow, the elective that we offer through FACTS About Fertility is the only one of its kind, not only in the United States, but in the world. And so we are actively working not only to reach more medical students, but we've put together a nursing committee so we can begin to translate and adapt this content for nursing schools. And we developed a continuing medical education course because there are so many physicians, midwives, nurse practitioners, other health professionals in practice that didn't have the opportunity to learn while they were in training and so are interested and open now. So we're trying to reach them through all of these avenues, as well as through our conferences, which has been just really great and encouraging to see the interest in the medical community.
Mm-hmm. I mean, it's so amazing to think of what happens when you just kind of start somewhere
I know.
many years later. And I think it also just speaks to, how much work goes into it and how slow change really happens.
Mm-hmm.
You know what I mean? But I think that it's amazing. So for anyone who wasn't aware, right, this is really good news. Thousands of doctors now have been informed to a much greater degree, but we still have, a long ways to go.
Mm-hmm.
So, a couple questions to get into it. And I'm sure I've probably asked similar questions in previous interviews, but maybe share with us just, from your experience, obviously as a physician, but now as an educator who's worked with so many different physicians, how are physicians trained to respond to medical issues? The question is, why is it that, this is something where I hear it in my professional life and personal life. I hear it from almost every single client. And then, like, for example, I've had a couple of nannies help me with babies and, different people come into our home. And anytime the topic of what I do comes up, I hear all the period problems and I hear all the issues and I hear all the doctor, right? And it's always the same story. It's like, I have this problem with my menstrual cycle, insert whatever problem you want. And then they told me to insert 3 things, like the pill, this, or this other medication or whatever. So share with us your insights on this, especially from both sides.
Yeah. Like I said, from a patient perspective, when I was in college dealing with painful periods, which is very common in the college age population, the answer was, let's put you on the birth control pill. And I thought to myself, but I don't need birth control. They're like, oh no, but this will treat your symptoms. And I was like, but I only have really, really painful cramps for 1 or 2 days out of the cycle. Do I need to take a pill every day? They're like, oh yeah, this will be good for you. And I didn't question it because I wasn't a doctor then. And I really didn't know much better. So I followed their advice and, went on birth control and was taking it for about 6 months, having some side effects, but kind of brushed them off, was told like, oh, just give it some time. And I did until, I started to experience like serious cosmetic effects. I was having major hair loss resulting in a bald spot. And I was like, this isn't good. And the doctor's like, we'll just switch you to another type of the pill. I'm like, seriously, there's got to be something better. And like, what am I supposed to do about the bald spot? They're like, oh, we'll send you to dermatology and you can have injections. I'm like, yeah, no. And so I went off and didn't know what else I could do. And just kind of like a lot of women just kind of sucked it up and just kind of dealt with the symptoms. And, a few years later, I went to medical school and, there's a lot to learn in medicine, even more today. But the focus is really very much like disease focused and treatment focused in a lot of ways. What's the best drug, device, surgery that we can do to treat the problem? There's really not a lot of emphasis on what are things that you as a patient can do? What are the lifestyle changes? What are the dietary changes? What are the other factors that you really have control over that you can employ to improve your health? I mean, nutrition is a perfect example. I think nutrition is critical to good health. But when I was in medical school, I had a 6-week nutrition class that met every Friday afternoon for an hour. I'm like, I'm sorry, 6 hours is not enough to learn all the nutrition that we as doctors, need to learn. Whereas my pharmacology class lasted for 3 months for 2 hours twice a week. So we learn a lot about medication, but not necessarily alternative holistic approaches to healthcare. And the reality is the way our healthcare system is set up, at least in the United States, and, I'm not 100% sure in Canada and other countries, but doctors oftentimes, especially in primary care, have very little time with patients. They may have a 10, a 15, a 20-minute visit. That's really not enough time to get a root cause and come up with a fairly concrete, comprehensive plan to address the underlying issues. So if a woman comes in with painful periods or irregular cycles or abnormal bleeding, it's much easier to simply say, well, let me prescribe this hormonal pill to treat your symptoms. And in reality, I mean, that's the way that I was trained. When a woman came in with anything psycho-related, it was, well, we'll put her on the pill. And what I didn't know at the time when I was, first going through my training, the pill, while it oftentimes will treat the symptoms, painful periods, it will reduce the pain. Irregular periods, it's not giving her a regular period. To be very clear, the period marks the end of the ovulatory cycle. But with hormonal birth control, it suppresses the cycle and gives women a withdrawal bleed. So it gives the impression that she's having a quote unquote regular cycle when she's really having a regular withdrawal bleed. But again, not getting at why is she having irregular cycles? And now I know, as a physician who's trained in fertility awareness-based methods, I can look at the chart of a woman who has 40 to 50-day cycles, which we know is abnormal. Normal is between 21 to 35 days. And I can look at that chart and just on a quick glance tell you if it's more likely that she has polycystic ovarian syndrome, which is a common cause of irregular cycles, or if she's more likely to have functional hypothalamic amenorrhea, another very common cause of irregular cycles, but visually will appear different when we look at the female cycle chart. And more importantly, the approaches to treatment for both are different. The way the traditional medicine trains us is we put all of them on birth control and it quote unquote gives them a regular cycle, but it actually doesn't treat the underlying issues. And we lose sight. And in fact, we never learn in medicine that ovulation really is a sign of health. And it's a sign of health because it reflects the normal fluctuation in the female hormones that are critical. I mean, estradiol and progesterone, we think of them as reproductive hormones, but they are so much more. They are critical for brain development and adolescence. They're critical for mental health in women of reproductive age. They're not simply something that we can just shut down and not experience any adverse effects from. This is why I think it's so important that women from a young age, from adolescence, learn to chart their cycle and use their cycle chart as a daily diary to help them understand what's happening with their hormones.
Mm-hmm. So important. So much of what you said. When we were talking before we hit record, or before we hit record this time, One of the things you said that stood out to me was women deserve real healthcare.
Mm,
And ironically, I feel like I said something similar on an interview when I was talking about normal parameters, of the menstrual cycle. And I was mentioning that pain, though common, isn't something we should consider optimal, right?
right.
And so just, share with us a little bit about that comment, especially coming from a physician, that
Yeah.
women deserve real healthcare.
Yeah. Yeah. I mean, women are not just smaller versions of men. We are biologically different, and we're biologically different from the very beginning. Women, once they go through puberty, their hormones function on a cyclical basis over weeks. Men, their cycle is a 24-hour cycle, right? So we're different. There are different times in our cycle when our energy levels are different. We just published a research blog on our facts website that looks at like the likelihood of tearing your ACL depending on where you are in your reproductive cycle. I mean, so it's not just about reproduction, it's about our overall health and how our hormones affect our overall health. And women are unique, and it's important that women learn to understand and observe their biomarkers that reflect these internal hormonal changes, because that's what allows us to identify if there are underlying abnormalities. Perfect example, you mentioned pain is not normal. I know so many women who suffer for years with period pain who are told, oh, that's normal, only to find out, like, actually, it's not. Just this past week, I saw a woman who, described when she was in high school and college, she would have debilitating periods that left her doubled over for 2 days, sometimes vomiting, and just she would take ibuprofen like they were Tic Tacs just around the clock. Was seen by a doctor who had recommended hormonal birth control, and her mom was like, I don't know that that's the best option. Are there other options? And was told, well, no, just keep taking the ibuprofen. So a few years later, when she got married and was trying to get pregnant and struggling, she had struggled to get pregnant, had a miscarriage, was seen by a NAPRO trained doctor and had surgery, and was found to have stage 4 endometriosis. That's serious. And in the United States, it takes still on average about 10 to 12 years from the onset of symptoms to the diagnosis of endometriosis. 10 to 12 years. When I talk about this to mixed audiences, I ask the men, would you put up with being doubled over in pain every month, like vomiting for a decade before you would look for a diagnosis or insist that the doctor figure out what is wrong? And yet so many women suffer through or suffer in silence or have their symptoms, quote unquote, treated by suppressing their cycle without actually treating the underlying cause of endometriosis. Now, when I have young people charting their cycle, I can look at a chart, and if I see spotting 2, 3, 4 days before the period, that can be an indicator of endometriosis. So even in a woman that may not have painful periods, but may be struggling with infertility, if I see that, that says to me, we need to look for this. Is this a cause of your painful periods, of your infertility? And if it is, women deserve to have that treated, right? Again, with endometriosis, women are commonly put on birth control because it will suppress the pain, but the disease process will continue. And the appropriate way to treat it is surgically. And so we need to be able to refer them to surgeons, whether they're NAPRO trained or trained in minimally invasive gynecological surgery, to actually go in and remove all aspects of the endometriosis that is contributing to this pain, inflammation, possible infertility, so that couples can conceive or women can have normal, healthy cycles where they're not doubled over in pain month after month after month. So, bottom line, I believe women deserve real reproductive health care, which in many instances requires us as physicians to diagnose the underlying causes and restore the reproductive system to the way it's designed to function.
Mm-hmm. It's so important. For anyone who's not familiar with NAPRO technology, could you briefly explain what that is?
Sure. So within the field of fertility awareness and fertility awareness-based methods, there are a number of methods that are available for women to learn to chart their cycles. There are ovulation or cervical mucus only methods, including the Billings ovulation method and the Creighton model. The Creighton model was developed by an obstetrician gynecologist, Dr. Thomas Hilgers. And Dr. Hilgers also developed the first real medical model of natural family planning or fertility awareness and restorative reproductive medicine. So he developed what we refer to as NAPRO technology. It stands for Natural Procreative Technology. And he started his work in the 70s, and over the last few decades, he has continued to develop and do research and refine this approach to using the Creighton chart, again, as a diagnostic tool to help identify potential underlying causes, to target laboratory testing based on the cycle, to then tailor the treatment to, again, get at the root cause. So natural procreative technology, or NAPRO technology, is one of the medical approaches or protocols that are used to address underlying reproductive health issues. Since the development of the Creighton model and NAPRO technology in the 1970s, there are other natural or fertility awareness-based methods, including symptothermal method, symptohormonal method, like the Marquette model. But there have since been two new medical approaches or protocols that have been developed. One is FEM, which stands for Fertility Education and Medical Management, and the other is neofertility. So NAPRO, FEM, and neofertility are the three medical approaches that can be used to offer women restorative reproductive medicine. That is a medical approach that's designed to restore the reproductive system to the way it's normally designed to function. And I should say, by way of disclosure, I am trained as a NAPRO medical consultant, as a FEM medical consultant, and as a neofertility medical consultant. And I will say each of these approaches have their strengths and each has their shortcomings. So as a physician, I feel very fortunate to have had the time and the energy to invest in learning each of these approaches, because I think it allows me to provide more comprehensive care to the patients that I see in my practice.
Mm-hmm. I think you may have answered this question, but I wanted to, because I feel like it's such a good transition into this concept of restorative reproductive medicine. I mean, what I've gathered from you is that the way that you're using this term is that it seems to be the kind of combination of fertility awareness charting, so charting the cycle, but also using a medical approach alongside the woman's chart to then actually restore from that medical standpoint. So maybe share a little bit about that. Did I get it right? And share a little bit about that.
Yeah, no, I think that's great. It's interesting because I often get the questions, why don't doctors learn about fertility awareness or fertility awareness-based methods? And part of it is that, frankly, women don't need doctors to be able to use a fertility awareness-based method, right? Women are smart. They need to learn from trained educators who can teach them the biomarkers to observe whether it's cervical fluid, basal body temperature, or urinary hormones. But you can learn this from a trained instructor like yourself, Lisa. And so women can learn to chart their cycle with a fertility awareness-based methods. Where physicians play a critical role is when we can take that female cycle chart and use it for what it's designed for, what the American College of Obstetricians and Gynecologists pointed out in a statement in 2015. The female cycle really serves as the fifth vital sign. So we can use that chart as a vital sign, as a historical document to help us identify what are potential underlying abnormalities within the cycle. And then for physicians that are trained, or I should say not just physicians, but other medical professionals, nurse practitioners, midwives, physicians assistants, etc., who are trained in NAPRO technology, FEM, or neofertility, we use that training to, in conjunction with the female cycle chart, to engage in a shared partnership with our patients to then diagnose and treat underlying issues. And so this is where physicians and other medical professionals matter. We can take the chart that the woman does an amazing job in documenting her daily hormones as a tool, as a diary to help guide our laboratory testing. And then based on that, the treatments that we want to implement to help restore her hormonal balance, her cyclical balance, her normal biologic anatomy, again, with the goal of restoring the reproductive system so that it functions in a normal, healthy way.
Popping into today's episode with a quick question. Do you like paper charting? Today's episode is brought to you by the Fertility Awareness Mastery Charting Workbook. This is the first beautifully designed, fully customizable paper charting workbook designed with you in mind. With 3 years worth of charting pages, the Fertility Awareness Mastery Charting Workbook has you covered. If you've been looking for a solid alternative to charting apps, you'll love this charting workbook. The FAM Charting Workbook is available in both Fahrenheit and Celsius editions and is available in spiral-bound, paperback, and ebook versions. Head over to fertilityfriday.com/workbook to order your copy today. That's fertilityfriday.com/workbook. Now let's go ahead and jump back into today's episode. I mean, when you think of it that way, it obviously just seems like, well, yeah, this is what we should do, right?
Like when you, it's not what we do as doctors.
Yeah. Like
if a leg is broken, we set it, right? We don't here, just take lots of Tylenol so the pain goes away and you don't notice. No, fix the problem.
But it's interesting because within medicine, I mean, from an outsider's perspective, it does seem like the two approaches that you just described. So you have a broken leg, approach 1 to like set the leg, but approach 2 to give, medication for the leg. It feels like both of those things take place in medicine. There's certain situations potentially in acute care, like when your physical body is damaged, where the initial approach is to let the body heal. But then when it comes to other more chronic conditions, it seems like the traditional allopathic medical care seems to just be less equipped to treat certain conditions. It seems like certain chronic conditions, maybe.
Yeah, absolutely. I think that's absolutely true. And it's funny because I'll often, when I'm teaching my students, I'll often explain to them that as physicians, sometimes it's easier just to give, the quick fix, right? Sometimes it's necessary, right? If a woman comes in and she's hemorrhaging from heavy, heavy menstrual bleeding, we need to stop the bleeding, right? But then we need to figure out, why is she bleeding like this? What is going on? How do we fix that underlying problem? So if a person comes into the emergency room with a broken leg and is in agony because of his broken leg, you're not going to set it first, right? You're going to give pain medication to treat the immediate acute symptom. But then you're not just going to keep giving them pain medication. You're going to step back and say, like, okay, let's fix the underlying problem. And it's the same thing with women's reproductive health, right? If a woman is having an acute issue where it's debilitating, like heavy bleeding, we may need to give her medication to stop the bleeding, but then we need to figure out, why is she having really heavy bleeding? How do we treat that? Women, and again, this is where I would say, like, women deserve better. They deserve, a diagnosis. What is the underlying cause of the heavy bleeding? And they deserve treatment. Same thing, like, a woman is coming in with debilitatingly painful periods. Certainly you want to give her medication to treat the painful periods, but you also then want to go in and diagnose, why is she having debilitating painful periods? It's not enough to just give her birth control around the clock or pain meds every month. Let's figure out, why is she having these painful periods? Is it endometriosis? Is it adenomyosis? Is there other underlying causes? Does she have adhesions? And then go in and fix, identify, diagnose, and treat the underlying issues.
Mm-hmm. And I mean, as you talk about this, I feel like to try to put into words all the things that are coming to mind, I think that from my perspective, I feel like women need to be warned that that's not how medicine works most of the time, right? Most of the time, we are giving them pain medication while the leg is broken and no one's offering to set it. When it comes to women's health issues, I might be using that analogy from this point forward. But I mean, that's what it is, because you have the woman with exceedingly ridiculously painful periods, or she's having flooding, just complete ridiculous levels of bleeding. And even in those cases where it seems so egregious that someone should be asking a question, often it's not happening. And so in your work, you're addressing it on the medical end, trying to educate doctors to look deeper. And then in my side of things, I'm trying to educate the woman so that she has more information, so that she can ask better questions and potentially find her way to the physician who wants to look at this. One of the interesting points about the restorative medicine that I was thinking of was you mentioned naprotechnology, FEM, and neofertility. And each of those modalities are not taught in med school. So all of the doctors who practice these approaches, they had to take an interest in these topics and independently study this separately, specialize after medical school. Maybe talk a little bit about that and talk a little bit about how physicians are finding their way to these types of trainings and educating the listeners so that they know that the average doctor just doesn't have this information.
Yeah, that's a great question. And I often encourage women to please be patient with your doctor. I was one of those doctors that like all I knew was how to write the prescription for birth control or refer for an IUD placement because I wasn't trained any differently. And for me, I just happened to have a senior resident who was trained in the Creighton model when I was on OB call one night, and she shared about it with me. So it was just sheer luck that I learned about this, but it was transformative. And so I encourage people like share, tell your doctor. They may be dismissive. Unfortunately, a lot of doctors are because we develop this complex, like, well, I'm the doctor, so I know more. The reality is we don't. There's way too much for us to know everything. But yeah, doctors don't learn about this. Facts published a research study last year, and it's on our website where we looked at what is taught in medical schools when it comes to reproductive health and family planning. And fertility awareness-based methods are mentioned less than 4% of the time. There are some schools that don't mention these methods at all. Most of the methods by name, like Creighton, aren't talked about. So for many doctors, it's a personal experience. It's a friend or a family member. It's a patient that comes in. My FACS co-founder, Dr. Bob Motley, is also a family physician. He was in practice for like 20 years before he learned about these methods. And he happened to have a medical student who was rotating with him who challenged him on this. She did it in a very pleasant, polite, but like, well, what about this? Well, what about having her chart her cycle? And he's like, what are you talking about? He had no idea. And so one of the things that we've done at FACS is we've developed a Share the Facts folder, but we've also just published basic research articles. We published one in 2022, Fertility Awareness-Based Methods for Women's Health and Family Planning, that is basically a detailed summary of the research from the last few decades, looking at the effectiveness of these methods from a family planning perspective and a women's health perspective. I would encourage all of your listeners, it's available for free on our website. Download it, print it out, share it with your doctor, and encourage them like, this is rooted in science. There is good evidence. Like, please help me, help patients like me, and learn more about these methods. And like I said, because we don't learn about this, this is not, routinely taught in medical schools. FACS is focused a lot on the students, but we recognize we need to be able to support the physicians and the medical professionals in practice. So we do offer continuing medical education courses. We have our virtual conference coming up in a couple of weeks, where we're looking at it's called the Continuum of Women's Healthcare, how we can use the female cycle chart to address women's health issues from adolescence through menopause, because every woman of reproductive age, whether she's, 11 or 12 or 51 or 52 or anywhere in between, like, deserves doctors that really will take an interest and do their due diligence to look for the root cause, make the diagnosis, and employ a treatment strategy, again, that will restore the reproductive system to the way it's designed to function.
Mm-hmm. I love that you said that, and so many important points there. I think I would go so far as to say it was not luck, it was meant to be. And how incredible is it that you had the senior resident, you said it was, who had this training, and like, look what happened. Like, look what came out of that. So
it's so funny. We joke. Her name is Dr. Pearl Huang Ramirez. She's one of our FACS speakers. So FACS is now trained nearly 100 speakers who can go into medical schools and hospitals and give like an introductory talk. And she teaches as a part of our elective on a regular basis. And if you ask her, she's like, I don't remember that night on call. She doesn't remember that conversation. She's like, it must have been really late and I was tired. But this is why I tell people, I'm like, never underestimate the power of your words. Like, the doctor may not really pay attention. They may not respond with the enthusiasm that you would hope they would, but you may be planting a seed, right? And it may be the beginning of their transformation. Like that was for me. And so I encourage people, and this is kind of our motto at FACS, share the facts. share the facts about fertility awareness, share the facts about the female cycle as the fifth vital sign, communicate with your colleagues, with your classmates, with your friends, with your family, refer them back to our factsaboutfertility.org website for more information so that we can continue to expand the number of medical professionals that really are trained to treat women's health issues.
Mm-hmm. Yeah, I couldn't agree more. I always try to give that as encouragement. I remember when I first learned fertility awareness, I equate myself to like one of those yippy dogs, because like at the very beginning, you're just like everyone needs to know, like, right? So you're all annoying and like exuberant and all that good stuff. And, now like 20 something years in, I'm certainly just as passionate, but I'm not like the yippy dog anymore. But I really never underestimate you just don't know what's going to happen when you have these conversations. And
that's why I
sometimes
love sorry, go ahead.
I was just going to say, sometimes the doctor who's the most like just ridiculous, like the most like, this is nonsense. Like sometimes that person ends up being the biggest advocate. So you literally never know how the seeds you plant, how they're going to grow.
Yeah, you never know. And I was going to say, Lisa, this is one of the reasons why I love your podcast, because I have had people come to me and say, I heard you on the Fertility Friday podcast, or I heard this woman Lisa in this Fertility Friday podcast. And, she mentioned the Facts website. And so there's one woman actually, and I don't even know if you know this story. I have shared this story with you, but there is an OBGYN in Ohio by the name of Dr. Summer Holmes Mason. Summer graduated from medical school, did her OBGYN residency, never learned anything about fertility awareness-based methods, but was seeing more and more women that, she was treating in a traditional way, the way she was trained with, synthetic hormones, only to see like they weren't really getting better. They were dealing with side effects. Like she really was struggling with helping them achieve pregnancy beyond just referring them to IVF. And, she wanted more. And she shared with me later, she listened to a podcast that you and I did years ago, and it opened her eyes. And she came to the very first conference that Facts did, our first in-person conference in Cleveland, Ohio in 2019, became so excited and passionate, since gotten trained. And now she actually sits on the board of directors for factsaboutfertility.org. And it's all thanks to you, Lisa, for the work that you're doing with this podcast and in planting the seeds, which is why I always love getting to come back and talk to you more.
Mm-hmm. Yeah, it's just, and the interesting thing is that it's just the lack of knowledge. Mm-hmm. There's so many people out there who, if they had this information, it would completely change their practice. It would completely change their personal approach to fertility or whatever it is. So I think it just speaks to the fact that we have to keep going, keep talking about it.
I think it's challenging because it is time consuming. Like I shared with you before we started recording, I had a patient that I cared for who had primary infertility, and thankfully was able to get connected with a symptothermal teacher and referred to a surgeon, had surgery, was found to have PCOS, and was able to get pregnant, shortly thereafter. But then after that, had secondary infertility. Then she experienced multiple miscarriages before coming to me. And we really did a lot of work, and we discovered there was a gluten intolerance. So she needed to significantly change her diet, which she did very successfully, but it took time and effort. Then we diagnosed her with autoimmune thyroiditis and needed to treat that, which we did, again, employing some of the techniques that I've learned through neofertility, such as using low-dose naltrexone, which can be incredibly helpful. We addressed that. But even though we restored as much as we could, she still had the underlying PCOS that was affecting her fertility. So I was able to refer her to one of my NAPRO surgery colleagues. She had an ovarian wedge resection, which really went out of favor a few decades ago once IVF came on the scene, but is still a very effective treatment. And within a month after having her ovarian wedge resection, was able to conceive without any additional, medical support. So she was shocked.
Jump in, because I would imagine that the majority of the listeners have never heard of that and have no idea what you're talking about. Would you go into it a little bit more and explain what an ovarian wedge resection is?
Absolutely. So with polycystic ovarian syndrome, essentially what happens is you have many cysts, hence the name polycystic ovary, many cysts in the ovary. These are all small follicles that are producing estradiol. So it's throwing off the hormone balance. And the best way to describe what a wedge resection is if you imagine the ovary as like the game piece in a trivial pursuit, and you're just taking out a little piece of the pie, like you're just removing a section of the ovary where you've got a lot of these small follicles that are hormonally active, that can often reset the hormones so that her hormones go back into a normal balance. So it is a surgery. It's done laparoscopically. The doctor will take out a small piece of the ovary, and that can reset the hormones. And in this patient's case, she had surgery in September, she had a normal period in October, and she conceived in November. And after having had primary infertility, secondary infertility, and 3 recurrent miscarriages, she carried to term without any issues. And then after weaning that baby, got pregnant again within a month or two, like much to her surprise at how easy it was. And I was like, well, when you restore the reproductive system to its normal function, it will function the way it's designed and you will reproduce. And so she's very excited to be welcoming baby number 3 here very soon.
It's just incredible. And we were talking a little bit in the pre-chat about this ovarian wedge resection because there's so much information about PCOS that is dietary based supplement. There's so many different approaches that also work.
Yep.
But the ovarian wedge resection, the surgical approach to PCOS is truly fascinating because of the potential result. And like you said, it had fallen out of favor. It kind of makes you like, it's invasive, but you know what I mean? It kind of makes you wonder why it's not explored a little bit more in certain situations.
Unfortunately, most traditionally trained OBs are not trained to do it. I mean, when it was being done regularly in the 60s and 70s, it was an open operation. So there were more adhesions, more complications. But now, since it can be done laparoscopically, minimally invasive, it is a much, much safer procedure. But because there's IVF and IUI, many doctors won't even go that route. They'll just refer out, to what seems like a quick fix, as opposed to getting at the root cause. And I feel very strongly, especially with conditions like PCOS and endometriosis, which are the 2 leading causes of female infertility, we need to treat those underlying issues. And ovarian wedge resection can very effectively treat infertility in patients with PCOS, but you need to find surgeons that are open and able to do that. And for that, many NAPRO surgeons are, but again, it's how do you find them? FACS is on our website. We have a directory, a physician, clinician, educator directory that we're building, and we encourage if there are fertility educators or clinicians listening that are trained and you want to be listed, it's free. We just want to increase accessibility to these services to more women and men and people all over. So, but that's a way that hopefully we'll be able to help you find doctors that are trained to provide reproductive health care in a restorative manner.
Well, and as we start wrapping up, I feel like that's a really good lead into the next question I wanted to ask, which is share some suggestions for listeners who are now all fired up at finding these magical physicians who are trained in this way. What are some of the suggestions? Obviously, we are going to make sure to include all the links. And I think the FACS website is an incredible place to start, an incredible resource, and to kind of keep going back to that growing list of physicians and practitioners who are trained in this way. But do you have any suggestions, questions patients can ask? How do we find doctors that are really going to support us in this way?
Yeah, that's a fantastic question. I mean, like I said, we have our directory on our website, but it is very limited. And I do acknowledge that. I mean, I wish I had a bigger team and we could expand that, but we don't. But there are resources through the Creighton website, through the FemHealth website. Neofertility still has very few physicians that are trained in these methods. But I think it's a fair question to ask your doctor. Are they familiar with charting, using the female cycle as a 5th vital sign? Again, print out our review article on fertility awareness-based methods for women's health and family planning and give it to your doctor and say, are you familiar with these methods and the science behind these and what they're, how they're used to support truly restorative reproductive women's health care? I suspect many doctors may not be familiar and they may be dismissive, but don't despair and encourage them to learn more. And if you're really struggling, feel free to reach out to FACS if you want to email us at info@facsaboutfertility.org. As I said, we're trying to train more and more medical students and residents, not only in the United States, but in Canada and across the world. So, but recognize that that the numbers are so limited. I mean, it's probably less than 1% of the physician population. So it is kind of like finding a needle in a haystack. I mean, I hate to say that, but we are working to change that. And so anything that you can do to help us spread the word, to help share the facts, to help support the work that we're doing, even if it's inviting your physician, your midwife, your friend who's a nurse or pharmacist, say, hey, check out this website, check out these resources, please learn more. We want to be able to help expand the trained medical professional community. So in turn, our goal is to educate the medical professionals so they can in turn educate and empower women and engage men again in the conversation and care of reproductive health.
Mm-hmm. Yes, definitely. And if you have any, I feel like you've shared the website. We'll say it again, factsaboutfertility.org.
Correct.
Yes. And we'll link all of the places. Marguerite, it's always a pleasure chatting with you.
Likewise.
I'm a huge fan of your work. I've always been a huge fan, and I'm always thrilled whenever I have the opportunity to share about facts, because especially as someone in the fertility awareness world, we've talked about this before over the years, I'm sure, it's nice to have an organization that's working to bring everybody together, right? To put down our pitchforks and really work together, because at the end of the day, I think for anybody in this fertility awareness field, the field of fertility awareness-based methods, we are really trying to connect women to their cycles and understand what's going on and to use that in the way that's best suits them. So for the listener who's just loved this conversation, do you have any last words or thoughts that you'd like to leave her with?
Yeah, I also want to express a caveat, and this is something I share with my students as part of their orientation, the elective, when they're like, why don't we learn about this? And I think it's just important to highlight or discuss the elephant in the room. For, the term natural family planning is a much more familiar term. It was coined by the National Institutes for Health in 1974. But in the 1970s, the groups that primarily promoted natural family planning were faith-based groups, right? And still today, the majority of people that promote these methods promote it from a faith-based perspective. And so you may encounter teachers or doctors that come at it from that perspective. But the reality is that this is rooted in science. This is rooted in basic biology of how the female and male reproductive systems work. And so at FACTS, we really do focus on the science. We believe in respecting all people, regardless, of their belief system, their walk, where they're coming at from this issue. We encourage people to get engaged with the facts who want to promote teaching future medical professionals about fertility awareness-based methods, but don't be discouraged. It's like, I tell my patients who I refer for counseling, I mean, the first counselor may not be the right fit, but there are others. So just to be aware that people will approach it from different perspectives. But if you find someone where their teaching or their approach doesn't really resonate with you, rest assured there are people either trained in that method or other methods where you may be able to find what you're looking for. And so I want to highlight that. And again, I want to highlight that at FACTS, our focus is in sharing the science, because women deserve high quality healthcare that's designed to restore the reproductive system and their hormonal system, and so it functions in balance so they can live happy, healthier lives.
Amen.
Thanks, Lisa.
Oh, well, thank you so much for being here, Marguerite. It's been such a pleasure.
It always is. Thank you so much for having me.
Thank you for listening. If you enjoyed today's show, please share it with a friend. You'll find the show notes page for today's episode over at fertilityfriday.com/497. I hope that you enjoyed today's episode with Dr. Duane. It's always a treat to chat with her and to jump into the topic today of restorative medicine, and where the menstrual cycle fits into that is so refreshing. And I think for many of you who may have started to lose hope in the medical profession's ability to fully support women based on understanding their natural cycle and rhythms, really understanding the menstrual cycle, this episode hopefully gives you a little bit of a boost and shows you that there are medical doctors out there working to get this knowledge into, the hands of many. But it will take some time before this knowledge is truly mainstream. So with that said, I hope you have a wonderful weekend, whenever you're tuning into the show. And of course, as always, until next time, be well and happy charting. And that's a wrap. If you've been loving the podcast, then I know you'll love our Fertility Awareness Mastery Mentorship Program. This is our 9-month immersive experience that will completely transform the way that you work with clients, allowing you to not only teach fertility awareness to your clients, but to use the menstrual cycle as a vital sign and diagnostic tool in your women's health practice. We're starting again in early 2024. Head over to fertilityfriday.com/famlive to join the waiting list and be the first to know when registration opens up again. There is no program like this offered anywhere. Transform your practice in 9 months. Join the waiting list over at fertilityfriday.com/FAMMLIVE.